My name's Dr. Khaylen Mistry. I'm an academic clinical fellow in dermatology, which is a fancy way of saying that I'm training to become a dermatologist and have protected time throughout my training to do research. The bulk of my research involves using big data sets to answer questions such as how common is melanoma and what are the risk factors for developing it. I also research genetic testing in melanoma and patient research priorities. I'm very grateful to be given the opportunity to talk to you today about patient research priorities, not only because it's something that I'm very passionate about, but because it gives me the chance to be away from my home in Norfolk for a couple of days. So my girlfriend doesn't have the chance to propose to me on this leap year. All jokes aside, the landscape of melanoma has changed an awful lot over the past 100 years or so. In the beginning, all we had to treat melanoma was surgery. Over time, surgical techniques have advanced, and we now have techniques like Mohs surgery, which allow us to carefully remove skin cancers from delicate parts of the body. There's also ongoing research to think carefully about optimal surgical margins. Our understanding of melanoma has also advanced significantly. We've discovered new genes that are linked with melanoma, and we now sometimes perform BRAF, NRAS, and KIT genetic testing, which gives us key information about the suitability of treatments like BRAF inhibitors and prognosis. And it's crazy to think that over a decade ago now, in around 2012, we saw the expansion of immuno and targeted therapy for advanced melanoma. And we now sit here today with a catalogue of systemic therapies for advanced melanoma. And some of these drugs are licensed to treat stage 2B disease. So, it's clear we've come a long way, but there's much more work to be done and exciting things on the horizon. We're continually pushing to try and better prevent melanoma, achieve earlier diagnosis, and discover new treatments to improve survival. It's great to see all the hard work that goes on to raise public awareness surrounding melanoma and skin cancer more generally. These include things like school education campaigns, where information, tools, and resources are provided to children to safeguard them against UV radiation and the subsequent development of skin cancer, and Amy Callaghan's campaign to get VAT removed from sunscreen. As a co-editor of a dermatology journal, it pleases me to see an increasing amount of research into how we can better support our non-specialist colleagues like GPs in making an early and accurate diagnosis of melanoma. Most medical students receive 1 to 2 weeks of teaching to cover the whole of the dermatology curriculum, yet 15% of GP consultations involve some sort of skin disorder. So there's a clear mismatch there, and we need to do more to support our non-specialist colleagues. And finally, it was exciting to hear about the myriad of ongoing clinical trials presented by Professor Sarah Danson this morning. We continue to make remarkable progress with a great cluster of novel studies exploring the effectiveness of various treatments. There is no doubt that the key to good research is to focus on topics that are important to patients. All too often, health professionals think of research questions based on areas that they think are interesting, but of little importance to patients. We need to flip the script and begin by asking patients what they think we should be researching based on their experiences of what was done well and not so well with melanoma. Patients might come into clinic and ask questions that health professionals may not yet have the answers to. For example, a patient might ask, "Doctor, this immunotherapy that you propose, will it interact with my diabetes or blood pressure medications?" By giving patients a voice to steer the trajectory of future melanoma research, it will ensure that future research endeavours to answer questions that are important to patients, so we can better deliver health services which meet patients' needs. So with this in mind, we've designed a UK-wide study in collaboration with Melanoma Focus that aims to amplify the patient voice in directing the future of melanoma research. I'll now talk you through who can take part in the study, what taking part will involve, and how we'll analyse the data to obtain results. So who's eligible for the study? Well, anybody who's been diagnosed with melanoma within the past 10 years of any stage disease who lives in the UK and is over the age of 18 is eligible to take part in the study. Now, we've purposely kept this broad as we want to include as many different participants as possible. We want to include a diverse range of perspectives from a diverse range of participants of different age, gender, ethnicity, deprivation, disability, geographical region, and tumour stage, so that all groups are well represented. You may have already heard about the study through Melanoma Focus, who have raised awareness for the study through their website, trial finder, and social media platforms. We've also raised awareness through the charity Skin, who have raised awareness through their social media platforms, and we've raised awareness through word of mouth and patient support groups. So, as I mentioned, if you're thinking about taking part in the study, then you can email the research team. Upon emailing the research team, you'll be sent a pre-interview questionnaire. Now, this will describe some basic questions about who can take part in the study. This questionnaire will also describe some questions similar to those that you'll be asked in the interview itself, so you can begin to think about your answers prior to completing the interview. Interviews will last around 30 minutes. They'll be completed on Zoom at a time that's convenient for both yourself and the researcher. During the interview, you'll be asked questions about the areas that you think are important and interesting that we need to do more research into. What we really want to know is the areas that concern you most that health professionals may not have the answers to, or that you couldn't find the answer to when you looked it up online. There are no risks associated with the study. If you don't want to take part, then there are no consequences and will not affect your care in any way. If at any point you want to stop the interview, that's absolutely fine. And if at any point you feel upset or you don't want to answer a question, then you can let the researcher know and they'll either stop the interview, move on to the next question, or continue with the current question, depending on your preference. Interviews will be recorded and transcribed. Researchers will then analyse the transcriptions to identify the themes that emerge from conversations. These themes will then be presented and published so that other patients, researchers, funders and charities can learn from the study findings. No identifiable information will be shared at any point. So where are we at now? Well, the study is up and running and we've conducted a number of interviews so far and we're keen to interview more patients. We've completed interim analysis and some fascinating themes have emerged. The map on the slide shows some of the common words that have come up during conversations. As you can see, we've had some really interesting conversations and learnt lots. It's great to see that many of the conversations that we've had during interviews have spanned topics covered over the course of today, including immunotherapy, lymphedema, scarring, and the gut microbiome. You'll notice that conversations have spanned a real range of topics, and we've chatted all things stress, sun exposure, diagnostic delay, treatment side effects, treatment duration, and survivorship. This is purposeful. We want to give participants the opportunity to talk about any particular areas that are important to them. It's very much a blank canvas where participants can highlight their own perspectives on what they think future research priorities should be. So in terms of next steps, we really hope that this study will help to identify key areas in melanoma that we need to focus on to improve patient care. This work might lead to further studies such as a James Lind Alliance Priority Setting Partnership study, where patients, carers, nurses, and a range of type of doctors, including dermatologists, oncologists, and plastic surgeons, all collaborate to decide on the top 10 topics for future melanoma research. These are big studies and big undertakings, but they may lead to big funding opportunities from organisations such as the NIHR, which are the research branch of the NHS. Here are two examples of recent funding calls, one from the NIHR and one from a charity called the UK DCTN. These funding calls provide money to research studies that aim to address questions highlighted as a priority in previously completed priority setting partnership studies. You'll notice that the UK DCTN funding call provides a list of previously completed priority setting partnership studies within the field of dermatology. These cover conditions like acne, psoriasis, and hair loss, but there's no priority setting partnership study that's been done for melanoma as of yet. Your involvement may also lead to further opportunities to get involved with melanoma research. For example, we all know that sometimes it can be really challenging to easily digest information that can be found on a recruitment flyer for a study, or an information sheet about a study, or a lay summary summarising the results of a recently completed study. There may be opportunities for you to review short summaries of these documents to make sure that the information on them is useful and easily understandable for patients and the general public more widely. So in summary, we've come a long way in our understanding of melanoma, and this has led to significant advancements in the care that we provide patients. But as we continue to make progress, it's important that we take a moment to pause, reflect, and ask patients what we should be researching in the future. I've explained the purpose of our UK-wide study to give patients a voice in directing the future of melanoma research. I've explained who is eligible for the study, what the study involves, and how we'll use the results. And now we're asking for your help to take part and share your experiences so that we can learn from them. I'd like to say a big thank you to the research team at the Norfolk and Norwich University Hospital and the University of East Anglia, particularly Associate Professor Zoe Venables and Professor Nick Lavelle for their continued mentorship. John Reagan, our patient expert who's been involved in the study from conception, and Omzin, our master's student who's been helping to conduct interviews. I'd like to thank Susanna, Nikita, and the rest of the team at Melanoma Focus for funding the study and helping with recruitment, as well as Mary Tudor and the team at Skin for helping raise awareness surrounding the study through their social media platforms. And finally, and most importantly, I'd like to thank all the patients that have been involved in the study so far for taking the time out of their busy schedules to share their thoughts and provide really useful insights. Together, we've established a strong collaborative network, which I'm confident will help to guide the future of melanoma research. So without further ado, if you'd like to take part in the study, then please do send us an email at melanoma.qualitativestudy@uea.ac.uk, or you can send a letter addressed to myself at the Norfolk and Norwich University Hospital. I'll pause for a moment so you have some time to take a picture of the details on this slide, or if you'd prefer, do come and have a chat with me after this talk, and I'd be more than happy to chat with you about the study and share the details with you then. Thank you very much.